How often to screen your prostate gland for health? When it comes to screening your prostate gland for health, many factors come into play. Prostate cancer screening mainly involves the prostate-specific antigen blood test, often paired with a digital rectal exam. The timing and frequency of these screenings depend on individual risk factors like age, family history, race, and overall health. For men at average risk, discussions about screening typically start between the ages of 45 and 55. Different health organizations have slightly different recommendations. The National Comprehensive Cancer Network suggests starting at 45, while the American Cancer Society recommends beginning at 50, and the U.S. Preventive Services Task Force advises starting at 55. For men aged 55 to 69 who have a life expectancy of more than 10 to 15 years, screening decisions should be made in consultation with a healthcare provider. This shared decision-making process allows you to weigh the benefits and potential harms of screening. If you decide to proceed with screening, the general recommendation is to have prostate-specific antigen tests every 2 years or more. This approach helps to minimize the risks associated with overdiagnosis and overtreatment. Some guidelines suggest screening every 2 to 4 years if your prostate-specific antigen levels are low, specifically below 1 nanogram per milliliter. Men who are at higher risk, such as African American men or those with a family history of prostate cancer, may want to consider starting their screenings earlier, around ages 40 to 45. These individuals may also need a more personalized screening schedule. On the other hand, routine screening is generally not recommended for men aged 70 and older or those with a life expectancy of less than 10 years, as the potential harms of screening may outweigh the benefits. If your prostate-specific antigen levels are elevated, for example, 2.5 nanograms per milliliter or higher, yearly screenings may be suggested to monitor any changes more closely. It is essential to remember that prostate-specific antigen levels can be influenced by various factors beyond cancer, including age, race, prostate enlargement, infections, medications, and medical procedures. Therefore, interpreting these results should always be done by a healthcare professional. In summary, the frequency of prostate screening is not one-size-fits-all. It often involves starting discussions about screening between ages 45 and 55 based on individual risk factors. For those with low prostate-specific antigen levels and no other risk factors, screenings may occur every 2 to 4 years. Higher-risk men might need more frequent or earlier screenings, while routine screening is not advisable for older men or those with limited life expectancy. Always engage with a healthcare provider to determine the best screening plan tailored to your personal health needs.